at least 99 COVID-19 fatalities were recorded in the country. This is 64 more than the previous report. This brings the total number of fatalities now in the country to 90,587. 21,999 COVID-19 cases were recorded in the last 24 hours. KwaZulu-Natal continues to be the epicenter of the fourth wave with 5,411 cases, followed by the Western Cape now with 4,609, and Gauteng with 3,807 infections. This latest increase represents a 30.6% positivity rate. There has been an increase of 593 hospital admissions in the past 24 hours. Now, more data is backing up what scientists have been saying for some time now. Getting fully vaccinated can save your life. The NICD says at least 87% of South Africans who died in the last 6 weeks were unvaccinated or only partially vaccinated.
On the right, you can see the number of deaths by age group, and you can see most deaths were in those over 60. Now, in terms of the vaccination status of those who've died, for those that we had data available, which is 309 patients, 40 or 13% were fully vaccinated, and 269 or 87% were unvaccinated or not fully vaccinated. So a majority of the deaths that we had data for that have occurred in South Africa were among people who were unvaccinated. And just to provide a bit more information in terms of the types of vaccines and the time from vaccination to admission, for J&J, there were 9 patients who died after receiving 1 dose. None of them had received a booster. And the time from vaccination to admission was about almost 4 months. It ranged from 87 days to 143 days. With Pfizer, there were 28 who had gotten a first dose and 35 who had gotten a second dose, and none had gotten a booster. And again, similarly, 4 months was the average time from vaccination to admission. And so very few people had died within 3 months of being vaccinated, just 5. And then 7 died within 3 or 4 months of vaccination, 12 died 4 or 5 months after vaccination, and 3 died more than 5 months after vaccination. And so, I think these are important data in terms of understanding the proportion of deaths that were unvaccinated, and some of them having a longer duration from vaccination to admission, suggesting, as we know, that there is some waning of immunity, and this may play a part as well.
As the world grapples with rising COVID-19 infections due to the Omicron variant, so we take a look at South Africa's response to the pandemic this year and the lessons we'll take to 2022. Joining me now to talk about this and more, South African Medical Association chairperson Dr Angelique Coetzee, as well as Infectious Disease Specialist at the University of KwaZulu-Natal, Dr Richard Lessells. Good evening to you, and thank you very much for your time and joining us tonight here on In Focus. And as I mentioned, we will evaluate the epidemiological trends in as far as the case rate is concerned, the rate of severe disease, looking at Gauteng in particular, what those results are telling us as far as the Omicron variant is concerned, and what can we conclude going forward into 2022, especially in what we need to do. Dr. Coetzee, let's start with you. I mean, if we look at the infection rate with the fourth wave, driven largely by the Omicron variant, we've seen a rapid increase than the previous waves. However, what we do find is that the high COVID-19 case rate is present despite a high degree or high rate of seropositivity. So let's go very slowly because we want people to really understand this. Let's start by explaining what seropositivity is. My understanding is it's the presence of antibodies.
Yes, good evening, and thank you for asking. Richard, if I get the facts wrong, would you please help me out here? But on the seropositivity, it is true, it's your antibodies that is circulating, meaning that either you had been clinically infected before and are aware, or you could have been infected and subclinically had an infection without you actually being aware of it. It is not always that easy to correlate your antibodies with good immunity. I think what is more important with COVID and especially with Omicron is your T-cell immunity, because that's the one that's going to protect you the most when you get severe infection and lying in ICU.
Right.
So for now, we have quite a high, there's quite a lot of circulating antibodies going around in most of the people in South Africa.
All right, Richard, let's bring you in. I think you'll help us here. The presence then of antibodies in vaccinated and unvaccinated people. What's the difference and what do we see?
Well, I mean, that's right. I mean, there are different types of antibody tests or different antibodies that you might measure. And some of those will only be present if you've been infected with the virus, whereas other antibodies you might measure could be there if you've either been infected or you've been vaccinated. So whenever we report these kind of studies, we always have to be clear what we've measured and what it might mean. So some of these recent studies from Gauteng, for example, were measuring antibodies that could have been present after infection or after vaccination. But the important thing now is these things really go together, that we see a lot of the population has built up immunity to this virus, either from infection or from vaccination or both. And the picture that we're seeing now is that at least is playing some part, and probably a big part, in this decoupling that you said, this kind of break of the link between the cases and the hospitalizations and the deaths. And that's clearly a very good and reassuring sign.
Yeah. As far as seroprevalence is concerned, when we look at unvaccinated individuals across the Gauteng province, was the rate of infection heterogeneous? In other words, was it the same everywhere in the districts, or did we find that there were particular things that were different in the various districts?
I think always when you do these studies, you'll see differences across the geographic areas. Those differences are not usually very, very large, but there will be some differences. And you also see differences across the different age groups and different demographic groups. So there is some heterogeneity that helps us to understand whether there are still kind of groups in the population that might still be susceptible to the severe consequences of this virus, that might still be at high risk for the hospitalization and the death, and that can help us to also understand where to really prioritize the vaccinations and also the booster vaccinations that are coming soon.
Now, Dr. Angelique, you already mentioned the fact that some cell-mediated immunity in the population is induced by previous natural infections, of course, others induced by vaccination. Now, if we look at the uncoupling of the hospitalization rate and the death rate from the infection rate compared to the previous wave, to what can we attribute this to?
That's quite a difficult question because currently in the ICU, when they make the diagnosis on, let's say, on a PCR, or it's been made before the patient has been admitted and it's a positive COVID test. At this stage, they do not distinguish between Omicron and any of the other variants. And I think one needs to get that data so that you can understand better the clinical picture that you are seeing at ICU level, and to help you prepare whether you need to whether, especially if you use monoclonal antibodies to try to treat these people, to know whether this is working, let's say, from an Omicron patient, whether it's working better for a Delta patient. We need to distinguish a bit better on that. So difficult to say who is lying in ICU. We know that, however, 90+% of the current infections are definitely Omicron. So we presume that the majority of people also in ICU would be Omicron-related patients. But to go down to the detail is at this stage not really happening at most of these levels. I'm not sure whether it's better in KwaZulu-Natal, but I know that in Gauteng that Steve Biko has been asked, so they would like to have those stats and data. Is it Omicron or Delta that's lying there? But at the end of the day, it's still a severely ill patient that you need to treat and need to get out of ICU walking out of ICU. So difficult to answer that question.
Yeah, but are we in agreement that weekly, at least, hospitalization rates are considerably low? I mean, if you look at the daily reported rate in the third wave and the daily reported rate in this fourth wave, are they considerably lower?
Oh yes, if you look at the data, there was a very nice graph in the report on Sunday, where they actually showed the 4 waves and how the hospitalization and ICU differed. And if you look at that, then you can see it's really a very, there's actually no difference. It's quite low. But again, you always need to remember that if it's you that's lying there, it's 100%. And we need to get people to understand, although we say it's a mild disease predominantly in the communities, we use that term because I don't need to admit you. I can treat you out of hospital at your home. It's not to say that you should not access healthcare and you should just stay home when you've got this terrible headache and body aches and pain. You need to do something. You need to go and get tested. We're not talking enough about how to empower the citizens out there and what to do, and still to try to get the doctors to prescribe at primary healthcare level the correct medications, especially based on what we are experiencing at primary healthcare level. So, if you look at the numbers, it's really not the same. And if you look at the daily admission rate, it stays more or less between 500 plus and 600 plus. It's not that there's one day 1,200 that's been admitted, and another day 400. It's more or less always the same. And if you look at the ventilated patients, if you look at the stats, it's more or less constant as well. So if it can stay like this, I think it's going to be tough this next 2 weeks, especially for KwaZulu-Natal and the Western Cape, because I think half of Gauteng is sitting there. So they took it over to KwaZulu-Natal and KZN, and we will see what comes back beginning of January.
That's very important, because I wanted to ask you that. Can we confidently say that now we have plateaued in Gauteng? Because my sense is exactly what you're saying, that maybe people have actually left Gauteng and moved to the other provinces, hence we are seeing those rising numbers there.
I agree. Richard?
Yeah, to be honest, I don't think that will make a big difference in how this plays out, because I think it was already spreading quite widely in KwaZulu-Natal and Western Cape. And so it's quite right that there will be a bit of an influx of people who are infected coming to those provinces. But I think the transmission was already at a high level. Right. So I don't think it will change things significantly.
Let's take a break. Back on In Focus, Dr. Angelique Coetzee as well as Dr. Richard Lessells with us tonight. They're helping us, of course, understand a little bit more what the Omicron variant has been doing as far as the data that we have now coming out of the studies done in Gauteng. Dr. Lessells, let's talk then about what is being reported, that the death or rather the hospitalization rate is not increasing, or rather the rate of hospitalization and the excess deaths did not increase proportionally. So if you look at the daily reported deaths, 1 per 100,000 is what was reported around now, and around the peak of the third wave we were talking about 25 per 100,000. What does that mean?
Yeah, so I mean, as you say, we can look at the actual numbers, but I mean, rather just look at the kind of broad picture here, that you're seeing something very different from the second and the third waves. And as you've highlighted, we've got these kind of different sources of data, and one particularly good one is the excess deaths from the South African Medical Research Council. And as you say, there's a bit of an increase in the last week of the excess deaths, but it's nothing like we saw in the second and third waves. And I know you always hear us kind of urge caution that we do still have to wait and see, because there is this lag between infections becoming symptomatic and then being hospitalized and then dying. But we see with the sheer number of infections in Gauteng over the kind of last month, the fact that that's not translating to a big increase in the excess deaths is very reassuring, and I think gives us some confidence in the picture that we see.
Yeah. Does that then give us almost that kind of confidence based on what Dr. Angelique was saying earlier on, that the rate of natural infection has spread so widely in the country that it has induced those robust memory T cells, and those are particularly assisting in a way, because what we do know, or what at least what we've heard, is that the Omicron variant evades antibodies.
I mean that's right. I mean, and that's a really important thing to remember, is that unfortunately, at least some of the reason that we're seeing this picture now and we're being reassured by this is because the very large number of people that have been infected across South Africa, and unfortunately that's come at a very significant cost of a large number of lives. Almost 280,000 excess deaths since the beginning of the pandemic, and we really mustn't forget that, because that's all our family members, friends, colleagues as healthcare workers that have died. So it really reinforces that the best way to protect yourself is with the vaccine, and even if you've been infected, to still get vaccinated, to give yourself that extra layer of protection that will really help against these new variants.
Yeah. And I suppose that's the other debate, Dr. Angelique, I mean, a very difficult one. Cell-mediated immunity is likely more durable than antibody-mediated immunity. How do you analyze that particular analysis, or that a particular session around the immunity that has been built with those who are naturally infected and those who have been vaccinated?
So again, you can look at what happens with the severity of the disease and what is lying in ICU and high care, how many numbers of patients are lying there. So if Dr. Lessells said, Prof. Lessells said that there's a lag between the infections and when you get the severity of the disease. So if you have good T-cell memory, you would have less severe, you're supposed to have less severe disease. We also know that especially Johnson & Johnson protect quite a lot against or help a lot with your T-cell immunity. And so if you see less people in ICU or easily treated in ICU, so it means that hopefully your T-cell response is good. But for the persons out there, the average person out there, it depends on the antibodies, and from there on, if your T-cell can also prevent you from going from infection to severe disease, that would be good. But it's difficult to determine this with blood tests. It's not that easy. So it's a lot about the clinical picture and how fast you can progress from just one day fine and mild and up and around, and within the next 24 to 48 hours, you all of a sudden develop shortness of breath, or you feel just extremely fatigued. It means your antibodies didn't really do what they should have done, especially if you have been vaccinated. And remember, if you've not been vaccinated or never had the virus before, you can't really have antibodies. You get your antibodies after you have been exposed in whatever form to the specific variant or virus. And then because then your body realize and can see here is the enemy that has been before encountered. I hope this makes sense. I'm trying to
So
explain it easily.
Does it mean if I previously had the infection and then I later get vaccinated, I'm almost doubly protected? Yeah, Dr. Lessells?
Well, I mean, what we see clearly across a number of studies now is people that have had an infection and then get vaccinated. They certainly have much stronger immunity, and particularly against these kind of variants that crop up. The capacity they have to fight off those variants is much stronger than people that have been vaccinated. But again, that's not a rationale to go out and get yourself infected. But it means that unfortunately here in South Africa, because so many people were infected before the start of the vaccine rollout, we think that is kind of adding to the protection that people have across the population.
Yeah.
And just one point, if I may, about the antibodies and the T cells and the antibodies waning. I don't think we've done a very good job of explaining this over the past year or so, because the antibodies in your body, whether they're produced by the infection or by vaccination, they will reduce over time, because your immune system's a wonderful thing. And if you're not being exposed to the threat, in this case the virus, your body doesn't keep churning out antibodies, because that's a waste of its resources.